Okay, surgery number 2 for skills is just slightly different. We're going to start it out the same, where we're using the mirror and the Explorer, and then we'll use the topical anesthetic and aspirating syringes. Once they are numb, well, we'll verify that they're numb by using the Explorer again. Once the patient is numb, then we're going to go ahead and use that periosteal elevator to break the PDL. And then we'll go through the series of small straight elevator, medium straight elevator, and large straight elevator. At this point, depending on what tooth we are numbing, we will pass the right forceps. Again, depending on how the handle is, there's one for the maxillary and one for the mandibular. Then the assistant will have a gauze in their hand, and the dentist will place the tooth and the forceps in their hand. And then we're going to use the curette, and we're going to make sure everything is gone, any debris or bone fragments. For surgery number 2, we will have a piece of a root tip that is still there. So we need to have root tip picks, and notice the one on the left is bent and the one on the right is straight. And one way to remember this is kind of like the hatchet and chisel from the amalgam. The one that is bent is for the mandibular. So if you're extracting a mandibular tooth and a piece of root broke off, that's the one that you would hand, the one to the left. If we were doing a maxillary tooth and a piece of root was left, the root tip pick you would pass is the one that is straight. So again, those are root tip picks. After that, then we will go back to the curette and just verify that we got that little piece of root out. Again, the whole procedure, you would be using the surgical saliva ejector and surgical HVE as needed. And then we're going to put gauze in the patient's mouth. It's a 2x2 gauze folded in half and in half, and that's going to help their blood clot. And the same instructions go: no smoking, drinking out of straw, or spitting for 24 to 48 hours.